Today we're going to be talking about cancer. Now, there's just been a number of articles that have been coming out over the last few years that have really made a big impact on me. But there's one that came out fairly recently from UCLA in looking at cancer reoccurrence. And the problem was with ovarian cancer. Very difficult cancer to treat, and the reoccurrence rate is about 80%. And they have 4 divisions out there at UCLA looking at what can we do to prevent the reoccurrence of these cancers. Ovarian cancer has a high reoccurrence rate. Breast cancer is anywhere from about 11 to 30% reoccurrence. Lymphoma, 20% average. Prostate, 15, 20%, depends on who you're looking at. But in all of these cancers, the concern is, what if it comes back? And here's what they've discovered. You go to the oncologist, and his job is to get rid of the cancer cells. Let's say breast cancer cells. And he can use radiation, he can use chemotherapy, he can use surgery, and they can do all of that, and they will come up and say, listen, all the nodes were negative, we got clean margins with the cancer, it's not spread anywhere, we've done PET scans, we got the cancer. And then, be it 3 or 4 years later, or a year later, or 20 years later, all of a sudden you notice something and the breast cancer is returned. What UCLA has discovered, and the University of Pennsylvania is looking at this, and a lot of institutions, they know this, that you can get rid of the cancer cells, but it's the cancer tumor stem cells that really determine whether you live or die. Because those are the cells that can become resistant to radiation, to chemotherapy, but those are the cells that determine if it's going to spread to the bones, the lung, the brain, the liver, where it actually will kill you. So they were actually looking at, in UCLA, looking at, do we even breach this subject with the patient? They've gone through all this hard work, almost ruined their health, and do we even tell them about the reoccurrence? And finally, after great discussions, they decided to tell these patients. And the patients were happy to know. Now, what they're doing now is they're trying to find a way to get rid of the cancer tumor stem cells because they have a very thick protein coat, which can make them impervious to radiation or chemotherapy. The other thing they found out is if the radiation and chemotherapy doesn't kill the cancer tumor stem cells, which there's a very good chance it won't, that they become more aggressive. And that's why with reoccurrence, it's always harder to get rid of those cancer tumor stem cells. So they are looking now at something called CAR-T that we do rarely here in the US, and it's only for blood-borne types of cancers like leukemias. But they're looking at it in solid tumors like breast and ovarian and all the other cancers. And what they're finding is that if they can take our natural killer cells and jazz them up, these natural killer cells really are, you might say, specific for getting rid of those cancer tumor stem cells. And what's nice is the Europeans have been doing this for a number of years, and we now can also do it here in America. You're probably not going to find it at the big institutions because it's a money factor. And the other thing is they are very new into this area versus the Europeans have been doing this for years. And we've done it on a few patients and been very pleased with our results. But this is to let people know that when you're talking to your cancer doctor, you need to ask them, what are you going to do for the cancer tumor stem cells? Because those are the ones that really are going to determine whether I live or die. The cancer cells you can kill, but the ones that are going to determine whether I live or die, what are you going to do?